to our second quarter Board of Advisors program. Our program is sponsored by Axxess, so a big thank you to Axxess for their support of this program and so many others. I'm Michelle Vopney. I am the 2021 Dallas Regional Chamber Chair in the Dallas office managing partner for EY, and I'm very happy to be with you today to introduce our great program. As usual, we have a very timely and outstanding lineup for you guys today, and I'm just going to provide a little bit of background. You know, for more than a year, we have been under this shadow of COVID-19 and the pandemic, and I think we're all really ready to get back to life and back to normal. And every day, our confidence is building a little bit as we're getting more and more people vaccinated. We know there's 3 vaccines that have been approved by the FDA for the United States, and we're seeing this supply really increasing, and a lot of us are able to go get our vaccinations. But I think that we're still wondering, you know, as we continue and we get to the end of May, where the expectation is that every adult will be able to get a vaccine if they want one. Now we're looking at, okay, some people are hesitant to receive the vaccine. I know in my family, we've all gotten vaccinated except my in-laws, just for whatever reason are not comfortable getting the vaccine. A lot of that's because people just don't have the good facts, right? They don't understand enough about it. And then there's a whole nother population of people that maybe they don't have internet access, so they can't register, or maybe they don't have the right transportation, or possibly they can't get off work to go get vaccinated. So today we're so fortunate to have 2 very impressive individuals who will be able to shed a lot more light on where we are and what we can be doing and what to expect. We need to be able to get these vaccines distributed efficiently to people who need and want them. And that's the topic of today's conversation. First, we're going to hear from Brian Tyler, the CEO of McKesson. And then after Brian, we're going to hear from another pillar in our community, Dr. Dan Podolsky, who's the president of UT Southwestern Medical Center. And then after Dr. Podolsky, Matt Garcia, DRC's SVP of Public Policy, will give an update on what the state of Texas is doing to help out the state and accelerate the distribution of the vaccines, and how the state is helping ensure as many people receive the vaccines as possible. Now, I would like to introduce John Elijah. He is the DRC's 2020 board chair, the CEO of Axxess, sponsor of today's program, and my friend. John will introduce our speakers. John?
Thank you, Michelle, and it's a privilege to be your friend. So thank you so much. We at Axxess are so proud to sponsor today's program. And as Michelle has shared with you, this is important, it's timely, what we're talking about today. At Axxess and as a community, I know we're all ready to get back to a more normalized life, but we also want to do it safely, as Michelle has shared with us already. And that's why we're so proud to be today's sponsor. As anxious and hopeful as we are for a return to normal, we also want to hear from the experts on how we can do that in the best possible way. Without a doubt, the success of our return to a normal life is dependent on making sure we have good information and that we're all working together. Last year, when the COVID-19 pandemic first emerged, the DRC quickly realized that one new focus area should be to serve as a trusted source of information for just news and information for our community. Well, not only did we serve in that role last year, as we're all trying to figure out how to operate in a new and a lot of times confusing environment. Well, this year, the DRC is continuing to deliver to members relevant and timely information that is helpful to decision makers and all of us. So today's program features 3 of our region's most engaged and respected leaders. Erin George, the Dallas office managing partner for Boston Consulting Group, will moderate today's discussion. When COVID-19 first emerged, BCG worked with their clients around the world, and I know this because I had conversations with them firsthand to help them think through how to adjust to a new way of operating. Now with vaccines being distributed and communities thinking about how to address the challenges that come with restarting our economy, BCG again has been there every step of the way, bringing their incredible talents for solving big problems, like helping us get back to a normal life. Erin, thank you so much for being our moderator today. Our first speaker is Brian Tyler, the CEO of McKesson. McKesson is the global leader in healthcare supply chain management, retail pharmacy, community oncology, and specialty care, and healthcare information solutions as well. Brian has led nearly every major business within McKesson, and he's also led the company's corporate strategy and business development unit. McKesson is one of the newest members of our Dallas region community, having moved from the West Coast to Las Colinas in the April of 2019, and we are so proud to have them be a part of our community and appreciate Brian's participation with us today. McKesson has been very involved already in our community, and we're so proud to have them here. After Brian, Erin will moderate a conversation with Dr. Podolsky, the president of UT Southwestern Medical Center. Dr. Podolsky and UT Southwestern have been playing such an important role in helping our community understand the science involving the development of the vaccine and what receiving the vaccine means to our community. Dr. Podolsky has been president at UT Southwestern since 2008 and brings an impressive set of credentials as an internationally recognized physician scientist. His agenda for UT Southwestern has been to focus on keeping it at the leading edge of science and addressing the most pressing unmet medical needs while being innovative in promoting the very, very best medical care for all communities in our region. And finally, our very own Matt Garcia, the DRC Senior Vice President for Public Policy, will give us a brief update on what's happening at the state level in Texas and how our leaders are helping with vaccine distribution all across the state. So at this point, I'll turn it over to Erin George of BCG. Over to you, Erin.
Thank you, John. Our first speaker is Brian Tyler, CEO of McKesson. Welcome, Brian. Thanks so much for being with us today. So let's jump right in. We have to start with this one. Texans like to think of themselves as different and from a special place, and I use that term loosely. How do you like living and working in Texas?
Well, first off, Erin, thank you for moderating today's call, and thanks to the DRC for putting this event together. I think it's a special, the role of business in the community in Dallas is something that's really special and unique, and it's in no small part due to forums and engagement like this. So hard to believe that it's been 2 years since we've moved here. If I put on my McKesson hat as a company, we've actually had offices in the Dallas area for a long time. I think our employees that live here always had great things to say about it and would in fact characterize it as a very special place. We made the decision to move our headquarters here after a very thoughtful evaluation and with very specific reasons. I think Dallas has been, one of the more economic growth focused areas. It's got a lot of high quality companies here. I know we like to do things bigger in Texas, and that certainly resonates with us as an organization in terms of aspiring to push for change and innovate and do make big changes happen in healthcare. On a personal level, I've been in and out of the state, all my career. I'm really proud, and my family is proud to now call Texas home. I have lived in roughly 10 cities in my career with McKesson, and I can tell you there is something special about Dallas. It's special the way it welcomes new people into the community. It's special the way it embraces and welcomes business into the community. So it's been really positive, and we're super thrilled to be here.
Well, that's great to hear. Given the type of move that your company made a couple of years ago, it's inevitable that not everyone was going to be able to make that move. How are you finding the local talent pipeline to be?
Well, you're right. And, we had moved part of our business here 4 years earlier. So we had a pretty good expectation for what the challenges of relocating people out of the San Francisco Bay Area are. And, because of the cost of living there, you're rarely relocating one career, you're relocating a working spouse or partner's career too. And so we knew we weren't going to get everyone to make the journey with us. And so that's why one of the important criteria that we factored into where we would relocate to is the available talent in the community. Because could we refill, basically 400 jobs and not only keep the talent level consistent, but hopefully upgrade it and diversify it. And I will just tell you from our experience, and we have, done a ton of hiring over the last 2 years. I couldn't be more pleased with the breadth and depth and diversity of the candidate pool. And frankly, the ease of finding people locally, but also in instances where you have to recruit them here. I think that Dallas is a place we find a lot of people want to get back to, that many have spent part of their career here earlier and they want to get back to. But there's no question, talent is at the heart of any good business, and talent is probably one of the leading criteria anyone makes when they think about this. And when you're thinking about rehiring 400 jobs, talent's first and foremost on your mind.
Yes, absolutely. Well, glad to hear that you're finding the talent here in Dallas. Let's transition to the priorities of McKesson. Your company is a global leader in the healthcare supply chain. And until the pandemic hit us, most of us probably took for granted how medicines and various healthcare supplies actually make their way into the hands of the healthcare providers. Can you talk us through what it has meant to be at the center of perhaps the most important and significant vaccination effort that the world has ever experienced?
Well, it's a terrific honor, and it's very humbling to be part of the effort. It's a very big point of pride for the team of 80,000 people across McKesson, and we take it very seriously because we view it as a near last step in what's been really an amazing collaboration between the world's greatest medical minds, researchers, and scientists, the government, the healthcare providers, the many frontline heroes that have been on the front line since day one. And, having the ability to participate in the distribution or run the exclusive distribution program for the country, it's a great honor, but it's also just an awesome responsibility. Now, luckily, McKesson has had a lot of experience with vaccinations. We are actually the largest distributor of the seasonal flu vaccination. And in 2009, some of you may remember the H1N1 crisis. Not quite at the level of what we're going through now, but in 2009, we also set up in exclusive way the distribution mechanism for the CDC as we got that vaccine out. So we were pulling on a lot of experience day to day and experience in this unusual model. So we really are playing two roles right now. In August of 2020, we got selected to be the distributor of the vaccines, but also to produce and distribute the ancillary supply kits. One of the big fears at the time with the PPE shortage was perhaps the vaccine got to an administration site, but would they have the necessary medical supplies to administer those? So we've been building kits, marrying those kits up with the vaccines and distributing them. And this work really started in earnest in December with the Moderna EUA. And while we're doing kits for Moderna, Pfizer, and J&J, we are doing the exclusive vaccine distribution for the Moderna and the J&J vaccine. Now, our role as the centralized distributor of the vaccine is really to receive in the product from the manufacturer, get it into inventory, store it, pick it, distribute it, and get it out to the site within 24 hours. Now, it's the US government that decides, who gets what in how much quantity, and they work in partnership with the states to take in orders, then based on available supply, parse those down to us for us to fulfill. We do this in 4 dedicated facilities that were really built exclusively to handle this program, and they were built in very short and quick order, over 3.3 million square feet, including picking lines that are at frozen temperatures. So we had to think about health and safety of our employees, how to clothe them, how to protect them, how to rotate them in and out, but still turn these orders around on such quick timeline. And just incredibly proud of what the team has accomplished here in a few short months. Everyone's aware the U.S. passed President Biden's initial goal of 100 million vaccines in his first 100 days, well ahead of schedule. It's now a goal of 200 million shots within 100 days, I believe. And this past week, McKesson passed our own 100 million vaccine distribution milestone. And I will say, it's not just a McKesson effort. We work with the manufacturer partners closely. We work with our last mile delivery partners closely. We've been delivering 99.97% of the vaccines on time by the day, 99.2% on time within the hour it was expected, and our quality has been 99.9%. So it's really just a massive testament to the dedication of our teams, just showing up every day. And it's a business, but in many ways it also feels like a service, and our duty. And so we're really pleased to fulfill it. Of course, across McKesson, we've got lots of other things going. We're doing this not just in the US, but we're doing it in a half a dozen other countries around the world where we have operations. And we've got our retail franchise banner now. Very excited that we've got almost 100 stores actually participating in the administration of the vaccine itself. So it's been a huge effort. It's a huge responsibility. It's a responsibility we take unbelievably serious, but certainly with humility and a sense of pride.
Well, congratulations. I mean, that's just incredible. I think we all hear about how quickly the science went, but to see, the effort to go into distribution is really, really incredible. Congratulations. In addition to McKesson's global supply chain expertise, your company is arguably one of the most sophisticated technology companies in the world. Can you tell us more about how important technology is to your future and how our schools and universities should be thinking about training the workforce of the future?
Yeah, sure. McKesson's not a super well-known company for as big as we are. And if you do know us, people tend to think of distribution, and because of conversations like the one we just had, but we're actually a pretty diverse healthcare services company, and technology really, is at the heart of our enterprise strategy. When we think about the transformation that's going on across healthcare right now, it's going to be driven by connectivity. It's going to be driven by data and AI and automation. It's going to be driven by rising consumer demands for how they consume that. And we've got to step up and continue to lead in all of those areas. So we actually have large technology businesses. When you go to your pharmacy and adjudicate a claim, that most likely goes over a McKesson infrastructure and technology. And within milliseconds, it literally comes back and tells you whether you're eligible for that medication and how much you might owe. So leveraging the power of technology and data analytics to improve efficiency and effectiveness of our operations is absolutely critical. And as we think about where the markets are evolving and kind of examples of how we can step up our game and roles we can play, I might just highlight one is our presence in oncology. And that's not just distribution, but it's real world evidence. It's participating in clinical trials. It's close partnership and alignment with the provision of oncology in our communities. And just this past year, we've built a data insights business. We just launched it. It's called Untitled, and it's got a goal really of connecting provider to manufacturer to fundamentally improve outcomes for patients. And the heart of it, though, is data and extracting insights and leveraging technology and AI and information to make better information and decision-making available at the point of care or when the prescribing and the care is happening. So we're super excited about this. It's one small example. We've got a great partnership with Amgen to improve cancer care in the community oncology setting. We've got a consortium with multiple players focused on lung cancer and how to improve non-small cell lung cancer outcomes for patients. So just there's one small example. I could go through a long list. We're working on access and adherence. How do we automate and use technology to ensure people who should be on their medicines, can be identified, get the right prescription, and then eliminate barriers to get them started earlier. We launched a product earlier this year, and we've cut the time to start therapy by 50%. That's a great number, but what that really means is more people are getting the right medicine started faster so they can get onto their healthier life sooner. you asked a question about schools and universities and workforce of the future. And I know this is something that we're all thinking about in our own operations. How do we upskill? How do we, really automate and make routine the things that can be handled by technology, but then use our people to use critical thinking and their expertise and their knowledge to solve bigger, more creative problems that unleash more value. So I really think it's critical that we're encourage students, particularly students from diverse backgrounds, to think about careers in STEM. This is, fundamental for the future success in my company, and I think probably in all the industries represented on this call. And I think people, in conjunction with that, we need to think then also about soft skills or the knowledge economy. How do we teach critical thinking? How do we teach the ability to be part of a team? How do we teach the value creation that comes from an inclusive workforce, a diverse workforce, a workforce that's open to debate, to really develop the best solutions that we can? So I think, learning agility is something that's really, really very important. And this doesn't stop just when you graduate, and it's not just our schools. I mean, learning should be a lifelong endeavor for all of us. And I have two small kids, and, it's something I talk about with them all the time. Be curious, keep learning, keep adapting to the future that's in front of you.
Great. What are some of the trends that you see or are seeing in the healthcare industry over the long term? More technology innovations, more scientific breakthroughs, perhaps, or trends towards healthier lifestyles? What are you seeing?
I mean, Aaron, I think you touched on three of the bigger ones right there. And interestingly enough, as we've come into this COVID, one of the things that we've done from a strategy perspective is really go back and test all our strategies and say, our strategy is still on point given the changes that have gone on. And interestingly enough, we think the answer to that is yes, but the urgency of all of them have been accelerated. So I think there's a couple of, maybe high level ones that I would point out for you. I mean, the first is the shift in sites of care to at home and digital. Again, this has been a long time, gradual secular trend that just got accelerated by the year that we've just been through. And it became really out of necessity. And I think you'll hear a lot of companies tell you that they were amazed how quick they could actually expand their digital interface and their capabilities when it was really a need, not a nice to have. But we think that is really true in the healthcare space. Providers, pharmacies really expanded telehealth and virtual services. And, while we've seen, some of this revert back to the more physical visits, there's no question it's had a permanent impact. And we think that that sort of overarching cycle will just continue to compress. The other trend that I think got accelerated is just a more holistic view of patient health and engagement. We probably talked a lot as companies about mental health and thinking about the ways we kept our teams and their families in a year of really isolation healthy. So I think the traditional view of population health is evolving. It's shifting from physical health to just a more holistic view of lifestyle and overall health, and certainly including mental health, behavioral health, social determinants of health. And I think that that's all really important. One of the things, just to break it down real simple, people have asked me over my 25-year career at McKesson, what's one of the biggest threats to your business? And I always tell them, good sleep habits, diet, and exercise. I mean, so I think thinking holistically about health is a big trend that I hope will not go away, because I think it's going to be a big part of solving our country's cost of healthcare crisis and access crisis. So, and then you mentioned the science, and I think it's unbelievably exciting, the innovation that's going on, in cancer care. It's just phenomenal, whether that's, CAR T or immunotherapies or others. I think the science is just improving at such a rapid and exciting rate. And you really don't have to look any further than the vaccines we were just discussing. I mean, both the Moderna and the Pfizer COVID vaccine are using a relatively new technology called mRNA, which allows very quick development of the vaccine and one that you can evolve and adapt really quickly too. So, I mean, I think the science is just fantastic, and it's just amazing. It's going to create challenges in how we pay for it and make sure we have access to it. But the underlying science is, I think, just incredibly exciting.
Yeah, agree. And it is interesting going back to the basics on wellness, we can get forced to do that. I'm going to shift back to some questions regarding the pandemic. When the pandemic was initially declared and we were still learning about the virus, there seemed to be a lot of focus on the lack of supplies. And you mentioned at least, some of the kits to distribute the vaccine that you focused on too. Were those issues mostly related to just a simple lack of supply of PPE, or were there challenges by how widespread the shortage was, or both?
Yeah, this is an interesting area where the language can be subtle. In many ways, there wasn't a supply shortage. There was an excessive demand environment. Very few supply chains are built to have a 20x increase in demand overnight, basically. And so I think that basic, demand shock then got exacerbated when, completely normally and completely human behavior, but self-interest kicked in and people started to try to go and find and source their supplies on their own, which created a lot of noise for the regular supply chain. I mean, I can share many stories with you where we had product, on the dock, the purchase order had been cut, it was ready to ship the next day, and all of a sudden we get a call that it's not available because somebody, made a phone call and paid 3 times what our agreement was for. And so there was this really volatile first month when everyone was in a panic. Now, that said, I mean, I personally am speaking to my industry, not my company. I feel really good about the reliability, the efficiency that our industry was able to play. And I think over a few short months, as we came together with some government agencies, we came together as industries, we really brought a lot of stability to that process.
That's great. That's great. Yes, I know I did some emergency buying of gloves and masks myself, as did I'm sure most people in our country. As the COVID vaccine distribution has ramped up, as you talked about, like we also hear a lot about the need for it to be refrigerated, right, at a very special temperature. And many people were getting, vaccines that were potentially going to be thrown away at the end of the day. I mean, what are some of the challenges that come along with having to ensure those very specific storage requirements as you think about the distribution?
Well, I mean, from the distribution angle, it was certainly complex. I mean, you have one that's ultra frozen, like -80. You have one that's frozen -2 to 8, and then you have one that can be more ambient. So in many ways, it's 3 separate supply chains. But we had run I don't know 50 or 80 scenarios in the lead up to the launch of the vaccine, because honestly, when we were building facilities and making these plans, we didn't know which vaccine would be approved, in what order, indicated for who, or where it would be shipped. So it was quite a planning challenge to think about the facility that you need to design. But it's also been a huge education challenge for the provider community, and the rollout was first, rightly so, in large health systems that we're equipped with freezers and we're equipped with refrigerators and could handle the nuance of the different vaccines. And then, but as you start to push those into smaller provider areas, it was really tricky. And so like in the case of Pfizer, the ultra frozen, they actually created a custom box that could really self-contain the vaccine for weeks so you could draw out of it. But there's no question that this was really unprecedented in many regards for everybody. Not just distribution, but administration. And I think that's why, it took a little bit of time to kind of pick up the momentum and click in. People had to learn their way through.
Yeah, it makes sense. Lastly, we're fortunate to have the region's top business leaders with us on this discussion today. What can they do to help support McKesson and our area during this unprecedented time?
Well, first, I would say keep doing what I expect that you're all doing, and that is, take care of your employees, take care of their families, and play an important role in the community. Specific to the environment we're in right now, if I could say one thing, it would be, really be engaged in the education and the communication, and think creatively how you reach your teams and encourage them to get a vaccine. This is fundamentally a community problem. I mean, until the community reaches a certain level of vaccination participation, we're going to be in this situation. I was lucky enough when the state lowered their requirements to the age of 50 that a couple of weeks back, first time I was lucky to be 50, I got to get my vaccine and it was super easy. I went to one of the hubs here in Dallas. It was quick, simple, easy. So, if I can do it, I know other people can do it, but support your teams, think about paid time off to get a vaccine, think about who they might trust and how you get an audience with that person to really break down this vaccine hesitancy. I think as business leaders, we've got a really important role to play in the education and the communication and the encouragement. And so I guess that would be my one ask.
Well, I agree with you. Thank you for sharing that. We're going to leave it there and we're going to transition to Dr. Podolsky, but thank you so much for joining us, Brian.
Thank you, Erin.
Dr. Podolsky, thank you for being with us today. Let's get started.
Well, thanks, Erin. Really glad to have this opportunity to be with you and the rest of the group this afternoon.
Great. So to level set with everyone, let's start by understanding the role that UT Southwestern has played in providing vaccinations.
Sure. We were, very, I guess, honored in a way to be identified as a vaccination hub, really from the outset of the deployment of vaccine here in Texas. We received first supply of vaccine on December 15th, which was just a few days after the FDA had issued its emergency use authorization. And since that time as a hub, we have provided vaccine guided by the criteria established by the Texas Department of State Health Services. To date, that has meant we've administered approximately 250,000 shots, about 27,000 shots a week now, which comprises approximately 25% of the shots given in Dallas County, which stands just about a million. That represents for us about 140,000 individuals who now is, I'm sure everyone joining this afternoon will appreciate is eligibility above all those who are an adult 16 and above, which is really the limits for which the vaccines have been approved. I'm really glad to say that as of yesterday in Dallas County, just right at 2/3 of individuals 65 and older have received at least one shot. About 50% have been fully vaccinated. Among the 16 and over, about 35%. The numbers are similar in Tarrant County, maybe a little lower among the below 65 crowd. We have endeavored to be sure that there was access really across all communities. We're doing that through having established 4 different sites as convenient to people across Dallas County, as well as special efforts to reach out to populations who might have particular challenges, as mentioned by about earlier in this hour, not lack of access to internet, for example. We've had special outreach to congregants at Black churches in South Dallas to buttress our vaccine hub at the Redbird Mall. So our role has been to be a source for, as initially approved, of our own healthcare workers and other healthcare workers in the region, but now the entire communities of North Texas and specifically Dallas County.
Well, thank you. I mean, you guys have had incredible impact. We understand at the beginning, healthcare workers were prioritized by the state and right after the emergency use authorization. What was UT Southwestern's experience and impact of that initial process?
Sure. I would talk about experience in 2 dimensions. First, our experience and the impact of vaccination of our workforce who became eligible, even though we were providing access to healthcare workers beyond those in our own organization. But the effect was really dramatic. And we took the opportunity, realizing we were as early to the process as anybody in the country really to review the impact on our workforce, so that when we look in the first part of February, and we're able to compare approximately 8,000 employees who had been fully vaccinated with those 6,000 or so who had at least at that point chosen not to take advantage of the potential access. There was a dramatic difference in the instances of COVID-19 among those two groups. And when I say dramatic, 98% reduction in the group who had received the vaccine. The practical impact of that was that we went from a point in mid-December, just when we were starting to vaccinate, of having at any given time about 400 plus of our employees in required self-isolation or self-quarantine to early February having less than 20. And that meant those individuals were there to, if you will, join the fight and be there. And it couldn't have happened at a better moment because, of course, we all realized that we saw in January a surge, unlike any we had seen before. So the impact here was really very striking, and we took advantage of that experience to share it with others through a publication in the New England Journal of Medicine just a couple of weeks ago. I said there were two dimensions. The other was learning that access didn't mean uptake. We saw fairly rapidly acceptance of vaccine in nearly 60% of our employees. We are now at 80%, which is really, as I talk to my colleagues at other academic medical centers around the country, really kind of a high watermark even now. But to get from 60 to 80, and these were individuals who are working largely in an academic and more importantly, a healthcare environment, really took an approach that considered the various reasons for hesitancy. We saw a variation that was not surprisingly tied to ethnicity, race, socioeconomic status, educational attainment, and a number of other considerations. And we've gotten from 60 to 80 by really understanding among our different groups within our total employee base what their specific concerns were. And so I think it foreshadows what I believe will be hard work of the collective here in bringing in the entirety of the community to accept vaccination to get to that sufficient level that protects the community as a whole. And I mentioned the overall numbers for Dallas County at 65%, 67% for those above 65, 35 or so percent for those above 16. But if you look underneath that, nobody will be surprised to say there's quite a lot of significant variation when you consider that the vaccination rates in whites in Dallas County right now are at 54%, and among Hispanics at 25%, and among Blacks at 14%. So there's a lot of work to do to be sure that all of those who would benefit from it by themselves, see that benefit, and ultimately to the collective benefit of the community.
Absolutely. When we're going to talk about maybe a couple of the different pieces that give people concern. So the first is, by now most of us know at least a person or two who received at least a dose of the vaccine based on the numbers you suggested. But we still hear a lot of hesitancy around potential side effects. And do the side effects of the vaccine vary across the different vaccines? Should I be getting a specific vaccines? And how do you respond to something like that?
Well, it certainly is an understandable concern. And I think you respond by first acknowledging that a large number of people, about 50%, will experience some side effect. Now, the vast majority of those are mild side effects, a sore arm where somebody received the shot, perhaps a fever, which responds to Tylenol or other kinds of similar medications. And to say that that's really pretty similar to many other vaccines, actually lower than some that are long-standing and well accepted. And at the same time, serious side effects are really rare. They're regrettable whenever they happen, but to put in perspective, truly serious ones requiring a hospitalization, which is a pretty high bar, are on the order of 5 in a million. And so, as I say, you need to acknowledge it. Also, that they may be somewhat more common after the second injection for the Pfizer and the Moderna vaccine. And to pick up on one of the aspects of your question, I think there's modest differences, at least as found in the clinical trials of the 3 vaccines, but not enough to make a difference, I think, realistically. That's only one side of the cost-benefit analysis, as it were. And I think the other part of addressing that is to really make clear the risk of not getting a vaccine, the risk of getting COVID, and even though the majority of COVID cases are modest in their severity, if not actually asymptomatic, there are sufficiently severe to see, depending on where you look and what community at what time, between 2 and 10% who will require hospitalization. And overall in the country, of those hospitalized, mortality is as much as 9 or 10%. So versus 5 in a million, that's a pretty easy arithmetic, I think, if people understand it.
Yeah, that's a great comparison. Another common question we get, and I hear it a lot at BCG, given the younger workforce we have, is whether there are any risks from the vaccine related to infertility to those who are trying to get pregnant.
Yeah. Well, it's an understandable concern, and in fact, one of the groups that we saw as hesitant within our own experience in those early weeks were those women of childbearing age. I would say that it is an understandable concern. There is no data to suggest that risk, is an actual one in terms of experience with it. Talking with our experts, our obstetrician, and recognizing that what is clear from experience is that pregnant women who become infected with COVID-19 are at risk of more severe disease and complications, that on balance, the recommendation overall, and I wouldn't want this to be applied to every individual, they should consult their physician, but on balance, the greater safety is in going ahead and getting the protection of the vaccine.
Yeah. We're also curious about new COVID strains. We've heard a lot about them in the news and the increase in cases because of some of these new strains and what they might mean for the effectiveness of the vaccines that are currently approved and available. Can you talk a little bit about that?
Yes, there is some information. I wouldn't say it's entirely definitive and dispositive, and I'll touch on the 3 variants we hear most about: the UK variant, the one from South Africa, and the bad Brazilian variant. I think there's fairly compelling evidence of the overall effectiveness of the vaccines approved here. Particularly, I'll say the Pfizer and Moderna, where there was more exposure, as it were, to, or experience with, rather, the UK version during their clinical trials and the South African trial, and in which those individuals who turned out to have the UK variant in the first instance really were essentially as protected. There's as much protection in a population that had a fair amount of UK variants circulating as in other populations. And although there was somewhat a greater number of infections in the trials within South Africa, which included a fair number of individuals who in retrospect had the South African variant, it's important to realize that the severity of that disease was still, even when it was labeled severe, not so severe that they required hospitalizations or and certainly none of them died. There's a little less certainty around the Brazilian, and talking to our immunologists and experts and our vaccinology experts, it is at least plausible that that will be somewhat less, the vaccines will be less responsive, and accordingly, you know, as I'm sure many, or not everyone joining today will be aware, the vaccine manufacturers are hard at work and at developing what, if needed, would be a booster to address this and other variants. I'll just add that it is germane for us here in North Texas. We at UT Southwestern, in tracking and the trends elsewhere in the world, decided that it would be important to know what the strains were which were circulating here in our region, and so have really since the beginning of the year molecularly sequenced all the positive samples for patients who were diagnosed at UT Southwestern, and we expect that those are fully representative of patients who or others here in the region. And what we have seen is that in early February, the first detection of the UK variant. And in the time since that, the prevalence of that among the positive samples has gone from about 1 or 2% to now about 30%. So that's, does say this, it's important for us to understand that UK, and again, to take some reassurance in what we know. I'm also happy to share that as yet, we've not detected either the South African or the Brazilian, variant, but we'll continue to be vigilant by continuing to sequence all the new positive samples of patients who've come to us for care.
Great. I think that leads us to another question here, which is, especially given some variants, how long after vaccination does somebody attain protection from the virus, and will they have to continue wearing masks?
Questions I know that is on everybody's mind while you're nervously waiting to be sure you get beyond that vaccination period to get the full benefit. It's clear that there is benefit already. So there's protection, just not complete protection or not the full protection that's possible after one dose. In fact, when we looked at our employees, I mentioned the difference between those who hadn't been vaccinated and those who have been fully vaccinated. But when we looked at those who had received one dose, they already had seen about a 50% reduction in what would otherwise be expected to be the number of infections, which, by the way, were not acquired here at UT Southwestern in every instance, but in the course of their activities out in the community. So it's clear, and that was clear in the clinical trials also, that really from about day 10 after the first shot, you could see a difference between those participating in those trials who had received the vaccine versus those who received a placebo. In terms of getting the full benefit, that's usually at about 10 days to 2 weeks after the second shot for the Moderna and the Pfizer vaccine, really about the same for the single shot from J&J. But I would just add that getting that full protection does not mean complete protection. And so the trials were impressive, against historical norms of what you expect a vaccine in giving up to 95% protection. But 95% is not, and that was for clinical disease, is not 100%. And so not surprisingly, we certainly have seen at this point, having administered 250,000 doses, many people who were subsequently found to contracted COVID-19, many, I say, but a very, very small proportion of what you would otherwise expect.
Well, that leads to this question of, after you've received the vaccine, are you able to prevent the transmission of the virus? So of these individuals who got COVID, who'd been vaccinated, can they pass that virus on to somebody else? And when and how will we know? Yeah,
that's a very important question, which has just recently begun to be answered. First, to make clear why that remains an open question, the trials that led to the emergency use authorization followed members of the participants in the trials for the development of clinically evident COVID-19. They were not being tested for the virus per se, and certainly not on any routine basis. And therefore, it remained possible that the vaccine, while it might prevent severe disease, sufficiently severe in the sense of being clinically manifest, could, still allow someone to become infected, but in a way that left them virtually or actually asymptomatic. So it was a very important study that came out, I think the week before last, that gave the first really substantive glimpse at this and also encouragement. And it looked at 4,000 health workers who had been vaccinated, and then did test them week by week for whether or not they had the virus. And in that group, there was a reduction of just over 90% of virus, and not just that they didn't become ill. So it does look like it has a substantial impact. There's studies which bolster that from Israel, which has had a very forward-leaning national vaccination policy, and so is in a position to provide some early answers to these questions as well.
That's very promising. Lastly, the development of the COVID vaccine used new technology. What type of hope does this experience give us for rapidly defeating future viruses and disease?
Well, I think there's a scientific answer to that, and there's an organizational answer for that. And I'm going to pick up on maybe something that Brian said, which was absolutely correct. The development of these mRNA vaccines was at light speed. But people have been thinking about studying mRNA and its potential use for a vaccine for about 20 years. And what was possible in the course of a year, in an unprecedented development of a vaccine, was possible only because of the investment in the basic science that this country in particular, not exclusively, but this country in particular, has done through the National Institutes of Health and other agencies over the years to really understand the basic mechanisms of both viral infections, of vaccines and how they protect. And so I think it does say that we have actually because of that, a rich armamentarium of potential technologies that can be deployed for the problem at hand. So I'm not sure that's a crisp answer to your question, other than to say it underscores the importance that investment in science, and I'll say not just at the national level, at the risk of making the local plug here in Texas, as I pointed out to our state legislature, UT Southwestern was able to turn its research engine from the full range of 500 projects that go on this campus at any time to transition from a point a year ago when there were 6 focused on coronavirus to now 300, because of investment in infrastructure for science and research that comes with our state appropriation as a health-related institution. So that investment, it pays off. And the second is organizational. It's not, I think, as much appreciated that, when saying the kind of in a global way that this has been unprecedented and remarkable to develop a vaccine and advance the science, but it's been enabled by, internationally, an incredible transparency with data and progress, sharing across laboratories and institutions and companies, and galvanizing, beginning in the laboratory, and a lot of it has its roots here in Texas, to design a vaccine, to then work with industry, the vaccine manufacturers, to ultimately the McKessons and then the government. That is the point where we're now able to have this vaccine, where the last mile in this is again going to be getting people to accept it.
Yeah. Well, thank you so much. I mean, we're incredibly grateful to you for making the time today, and very proud for all that you've done for our community. So thank you for your time. I'm going to hand it over to Matt now.
All right, well, thank you so much, Erin. I will begin with the statewide activities and then move into how the state efforts are impacting the Dallas region. So real quickly, as of April 7th, 13.3 million doses have been administered statewide, and 8.6 million people have received at least one dose. So that's 5.1 million people, or roughly 17.5% of the Texas population, are fully vaccinated. Health experts estimate 75 to 90% of Texans need to achieve immunity to COVID-19 to reach herd immunity, which would mean vaccinating at least 22 million people, or nearly 100% of the adults in the state. One of the biggest challenges slash obstacles is vaccines are not approved for children under 16, who make up 23% of the population. So to increase the number of vaccines being administered, the state of Texas established a series of large vaccine sites or hubs across the state beginning back in January. The goal of these hubs is to provide more people the vaccine and a simpler way to sign up for an appointment. So Dallas County and Harris County are fortunate because we have the most vaccine hubs compared to any other county statewide. The three federally run FEMA sites located at Dallas's Fair Park, Arlington's Esports Stadium, and Houston's NRG Stadium opened on February 24th with the intent to operate for 6 weeks. Just this week, Governor Abbott announced that FEMA granted partial approval for an extension request, and these will continue to operate through May 18th. The extension is for personnel at each site, and the governor's office noted that the partial approval does not include extension of federal vaccine shipments and supplies. So all remaining needed vaccines would have to be provided by the state. Additionally, Texas Health and Human Services created a map tracking the distribution of and locations providing COVID-19 vaccines. This can be found on their website under the COVID-19 tab. Moving quickly to the Texas legislature. So we're in the final 2 months of the 87th Texas legislative session, and just this week, the House unanimously passed House Bill 5, the broad bill expansion bill that establishes a statewide broadband development office and mandates the development of a state broadband plan. This is a major step for Texas, as we have seen the move to telehealth and telemedicine during the pandemic, as well as the overall inequities in broadband access. And just as Dr. Podolsky just here recently mentioned, the challenges to getting some of our population even registered due to a lack of internet access. This legislation will be a game changer for the state of Texas. So quickly moving to the local impact. Looking at data that's been available for this last week, which is week 16 of vaccine distribution and the doses being administered, the Dallas region was allocated a total of 113,000 doses, and up to this point has received a total of 1.2 million doses. But these numbers do not include the federal allocation. So I just want to add that note in there. With the number of hubs and smaller vaccine sites across the Dallas region, our capacity to administer doses is about 180,000 vaccines per week. This means that the region can administer roughly 67,000 more doses weekly than we are currently receiving. The DRC has been active in advocating for more doses from the state, and we've been in constant contact with staff at Dallas County, as well as the Texas Department of State Health Services. And just this week, the city of Dallas has partnered with the Visiting Nurse Association of Texas to provide in-home vaccinations to Dallas residents unable to travel to a vaccine site. This initiative will begin on Tuesday, April 13th. So as you can see, a lot of great progress, but we still have our work cut out for us to keep getting our family, friends, and neighbors vaccinated. So that's a quick update on what's happening at the state level. I will turn the program over to Angela to close us out. Angela?
Thank you, Matt. Wanted to thank Axxess and John Olajide for being our sponsor for the event today. Thank you to Brian Tyler of McKesson, Dr. Podolsky of UT Southwestern, and Aaron George of BCG. Thank you so much all for joining us. Want to let you know that the DRC is actually launching a PSA campaign to encourage people to get the vaccine, particularly in vulnerable communities. So if you want to learn more about that, please contact one of the DRC staff. Right now, we believe that the community's highest priority is taking care of business and taking care of life by getting shots in arms and getting all of us back to visiting friends and family and attending concerts and restaurants and sporting events, really back to that Dallas quality of life. So again, thank you so much for joining us today. We hope to see you in person soon. Stay safe, and we are adjourned. Bye.